welcome to Community Action Now COVID-19 updates. I am your host, Angel Bulkes Jr. Community Action provides underserved communities with resources and to combat poverty and also youth advocacy programs. It supports youth advocacy programs, disaster management, education, and outreach. Since 2014, Community Action Now has assisted the U.S. Virgin Islands and the East Metro Atlanta area with such programs. In response to COVID-19, Community Action Now is providing a series of COVID-19 updates and informational sessions to the community. Today, on April 15, 2020, Community Action Now has invited David Boamah, founder and director of the Thread Foundation in Entuso, Ghana. David Boamah is the founder of the organization. He also has worked with, Community Action Now has worked with David Boamah and the foundation in Ghana. He's a West African ambassador for 4 years and has had a long-standing relationship with Community Action Now, which supports the DA primary school in Ghana. Community Action Now adopted the school and has provided much needed resources for the school and its operation. With me today, my co-host, Dr. Valerie Cadet, Associate Professor of Microbiology and Immunology at PCOM, Georgia, a med school in the Metro Atlanta area. Dr. Cadet has her PhD in infectious diseases, studying viruses and vaccines. Through her partnership with Community Action Now, Dr. Cadet serves as the public health advisor. She has appeared on Atlanta 11 News for infectious disease reports as an expert, as well as various news and radio stations throughout the Atlanta metro area and the Virgin Islands, providing COVID-19 advice and residents. Next, we have Ifat Walker, our next co-host, who is also the founder and executive director of Community Action Now, as well as a Metro Atlanta business leader and public speaker. Through her leadership in Community Action Now, she has provided us with leadership and also helped guide the organization to provide disaster preparedness and response services throughout Hurricane Matthew in 2016 in Haiti, Hurricanes Irma and Maria in 2017 in the Virgin Islands, and Hurricane Dorian in the Bahamas, and most recently now for COVID-19 global pandemic. She has focused on a social and economic impact of the disasters to our minority populations, those most at risk with the impact. Through her leadership, Community Action Now has supported over 20,000 high-risk disaster survivors through disaster response services. So without further ado, welcome everyone. Welcome Mr. David Boamah. How are you doing today? Oh, he's not on the line right now.
Oh, hello. I'm doing very well. I'm very grateful, to hear your voice, to see
Okay,
everyone.
Machi.
This that we say Majo means good evening.
Oh, it's evening. I thought it was Machi for good morning.
No, it's not morning, so it's evening here.
Okay,
So we say Majo. But
Machu.
or Machi means good morning, and I'll respond yeah. Okay, and
Okay.
Maha, that is good afternoon, and
Maha.
Majo means good evening.
Okay, well,
Maha
for us
means good
here, I guess it's Maha right now. For us here on this side, it's Maha. So Maha from our side, and on your side, good evening, which is once
Majo
again.
from my side. And Majo,
Okay.
Majo from my side. That is good evening from my end.
All right, great.
Yeah. So I hope everybody is doing very well.
Yes, so far so good. Today we're hoping to ask you some questions about what's going on in Ghana with COVID-19 and how the school is doing over there.
Oh, okay. Good. So when you talk of COVID-19, it's not something about only in Ghana. this has been more serious as in the nation and the world at large. Okay, it has become a global pandemic, issue. It also borders, Ghana. Okay, so talking in as in Ghana, measures were uh, taken in place, putting in place by the government. Hello,
We hear you. We're still here.
hello. Okay, so
Yes, we're here.
I must say, okay, let me first give the update. So far Ghana has done a total test, which I mean the screening of 44,421 people. That is 44,421 individuals have done the test for, have been tested for COVID-19. Some of the tests were through, like a sovereign test. People were being quarantined, and they tested them, like people who traveled from abroad, and then were being quarantined, and they tested, and they also did a contact tracing. They did also contact tracing, for people who have also engaged with, people that they have been quarantined, yeah, who have also tested positive. So in total, Ghana have tested 44,421 individuals. Some are include, it does include, people with, quarantine, and then also contact tracing. And we have a total of 636 cases, confirmed cases. 636 confirmed cases. And Ghana also record a total death of 8 persons. Total death of 8 persons. And you also have recovered, Ghana has also have a total recovered 17, 17. Okay. So we're not sitting on that. The government is doing very well, I mean, to put the measures in place. And these measures has been the lockdown, you know. And so it means that schools, colleges, universities are all closed, and everybody, is being in the house, for everybody to be home, so that we can manage the situation, so that there wouldn't be no much more, infection, or people contracting the virus. Okay, good. So, and this has also brought some impact. By so doing this, it has also brought impact into the economy, the Ghanaian economy. Okay. And as you can see, we have the socio-economic impact of the COVID-19 on the economy of Ghana. It's by direct and indirect route. Okay. So you see, through the effect of the disease, production, trade, transportation, and human life, especially the most vulnerable, are seriously affected. And human life, So we say there is slowing of global economic growth supply chain. Because when you talk of Ghana, you cannot do away with global economic, growth supply chain. Okay. And we say disruptions and extensions, the negative impact of the Ghana's own growth. And you have the foreign investors. Now also Ghana rely on, foreign investment. So we have the foreign investors mostly able to arrive into the country to transact, even undertake feasibility studies as a result of the closure of the most borders. Almost all the borders in Ghana are closed, are shut down. So you see, people are not traveling in, people are not able to go out, and also, come in. Right. So when you have like that, it means that work is not going on. I mean, well, because we have the foreigners coming. Okay, when you get to my end, like my community, I'll talk much about that. And it also have impact on education. As I did mention that schools are closed down, so that we don't want it to keep spreading. So it has also got an impact because, like we say, we have like as the number of COVID-19 cases increased. When it got to 21, Ghana recorded case 21. The government implemented measures of reducing the rapid spread of the disease of the virus. This includes social distancing and then lockdown of some areas within the country.
Right.
It never started. At first, it started from Greater Accra region, and then the Asante region, which is Kumasi, Kumasi being the city, the Asante region. Okay. So and then due to that, due to the lockdown, social distancing, schools and universities, government is putting measures in place to provide. So all the schools were closed down, and due to that, what the government has done is that they putting measures in place. So they have the e-learning programs on the local television channel. Okay. So when it comes to there's a question that this is very nice idea putting in place by the government. But let's go to our local villages, our local communities, the remote areas. How many people have televisions in their homes?
Yes.
So this has
Wow.
also become, it has also become, that is the big question. Okay,
But
how many
So,
people have
David,
televisions in their home?
David, can you hear me?
Yes, please. Yes, please.
I'm going to stop you just for one moment to repeat what you said. Just because there was noise, there was some wind in the
some wind.
background. I want to make sure everybody hears you. So you're saying that
Oh,
the government has gone on and put some e-learning on the television, but one of the challenges that if you go into some of the communities, some of the villages, are you suggesting that one of the challenges is that may not have televisions to be able to participate?
okay.
Did you hear my question?
Hello. Yeah. If I hear you well. So talking about repeating on the television issue.
Yes.
Good. So what I was saying is this: the government have put in, all sort of measures in place, and now since schools, are out of sections, okay, educational programs are still trying to be enrolled on the various local television channels. Okay, but the question is this: when you go to people living in the cities, don't have problem. There are some places where they don't have electricity. If you go to some of the local communities, the question is how many people are able to afford a television set in their houses, in their homes. Okay, so it means that if David be as a local David or Boamah, it means when all the programs undertaken on the television channels, I'm losing it. So
Yeah.
it is actually going to affect some people as far as education is concerned. So these are some of the, the challenges, the impacts. Okay. And then let me now also narrow it to in Tonso, which is the main focus of the main village for of community action now, because community action now is doing well in Tonso by trying to adopt the Tonso MA. It used to be DA, but now it's MA, Metropolitan Assembly. Initially, it was District Assembly, now Metropolitan Assembly School. Now, um, in Intonso, this is the Intonso community. It's a very busy, community whose, inhabitants are into trading, and the major work we do there is Adinkra and stamping, which is the indigenous. Like I'm wearing this Adinkra beautiful shirt, and then the kente traditional hand woven,
Mhm.
then embroidery. Okay, so that alone attracts a lot of visitors, foreigners. So Intonsi relied on foreign, business because foreigners go to Ghana, they go to Intonsi for Adinkra, they buy, people make money for living. And now tourists are not coming in, okay? And then how this has to go affect the living of the people in Tonso. Okay, and then so we say now I summarize like in Tonso community. It's a very busy community whose
Right.
inhabitants are into trading, Adinkra, and then Kente weaving. There is also a smaller number of the inhabitants who are into a small scale farming. This is because the
Mm-hmm.
Adinkra and then the Kente, these indigenous activities all our time. Okay. So we say due to the COVID-19, the community is having a hard time since there is a lockdown and all activities are put at halt. The inhabitants has no source of income and are facing great difficulties as a result of this pandemic. And it's true. And interestingly, like since as I'm working as a founder, and the leader of Trade Foundation, we are also dealing much about the vulnerable ones. And then we have an issue with single parenting. Okay, so
Mm-hmm.
all this, yeah, all this has the when this the especially the women. Everybody know that the men will do the weaving, making the beautiful adinkra, making the beautiful kente, the traditional ones, and at the end of the month, the women will also travel, bring them to the cities. So I tell you, people, women from Intonsi travel across the Ghana, go and then sell. So that while they go to sell, the men are also still working back home. They make the money, they make profit, they bring the money back. They also try to reproduce. And now it is not like that. Okay, and then also talking about social distancing, there is also a challenge here. We do practice, be the people in Ghana, we do practice the extended family system, not the nuclear one. And we have the secular house. So this is where a household, a compound house might have like 10 rooms in the house as a minimum. And assuming that if each room has three people, it means that the household is having 30 people. Okay, and 30 people live in the house, and we are also talking about social distancing. And this is also being more like a challenge to us that we are all praying and hoping that this issue of COVID-19, will come to pass. And then also, I did experience something this morning on my own. I was I was on a bicycle riding, and I saw a lot of children gathering elsewhere. And I asked myself, I asked them, what is going on? Somebody did favor and paid for a rice. A woman selling rice, a cooked hot food, and paid for it. And every child is rushing. They all want to be fed. They want to get, and they
Mr.
were very
Boamah,
crowded, very close to each other. So when you talk about social distancing, this is also, a challenge. I mean, to us. So now, before the rain, I'm just hoping that
Mr.
the
Boamah,
rain will not stop me. So let me tell you
Mr.
the
Boamah,
impact, of Trade Foundation.
I don't know if you can hear
Uh,
me.
David,
Hello.
David, can I stop you
Yes.
for a second? Can you hear me?
Hello.
Okay, Angel. Yes, can you hear
Yeah, I
me?
don't think.
Angel
Yes.
was trying to ask you a question.
Come
Yes,
again.
can you hear me, Mr. Boamah?
I can hear
Can
you.
you hear me?
Yes.
Okay, thank you. So I had a question in reference to the DA primary school. How are the families and the students, how are they coping with the changes
Oh, good. That is
since
a very,
COVID-19?
yeah. That is also a very good question. One thing that the government is doing well is they also have a patrol team, which involves all the military, the security personnel, which involves the fire service, the military, the police, you know, and then the immigration, and they are all trying to also advocate, and the NCCs, also the information department, and then also the local radio stations are also doing well, because they're trying to advocate giving out information on daily basis, trying to educate people on social distancing. Actually, Ghana, we have not had such an experience before, so people, are new to this. It's very interesting that when you go to some communities, people like you don't see like a child moving alone. The children it seems they don't know what is going on. They still play soccer, the youth. The reason that they ask them to stop, school so that they can be kept home, they still move as a group, playing soccer, doing things in common. Okay, that is why I'm saying that it's also tough for us because of the way our culture is, the way we were grown up. For instance, if I was grown up with my cousins, like with a big family, we are used to that. So it's hardly we separate ourselves. Okay, so sometimes people move together and they have this petroleum team, trying to separate people, trying to tell them, no, you don't have to do like this. You have to try to, So it's being practicing, but it's not commonly done because of the nature of our culture and how we have been grown up. Okay, so
David,
I mean that
David,
has been the impact because yes, please.
sorry, I think we have a slight delay. I wanted to ask you some more about what you were just talking about with social distancing. Also, sometimes the wind is pretty severe in certain places. Do you think you could stay still if possible? Because right now it's perfect.
Hello. In
Um,
fact, please, can you repeat? Can you wait a moment? Can you repeat your question? Because um, it's nearly going to rain, and then the wind is kind of blowing, and it goes up and forth. So, can you repeat your question so that
I
I do with
see.
it?
I see. Yes, let's try. Let's try to get you in one spot before the rain comes. But my question about social distancing is, I understand how difficult it is within your family units to do this. Have you guys been given guidance about wearing masks, perhaps?
About, can you repeat
Wearing
that?
wearing masks. A lot of countries
Good.
around have started doing
Yes.
this, including the U.S.
Yes. 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 That is a good question. In most cases, people, yeah, the PPEs, people we trying and also trying to advocate, and now people are also using the sanitizer, and then
Hmm.
trying to wash our hands, regularly. Also, the face or the nose mask, people are also, wearing it. But one thing is, you find people wearing it. For how long do they wear it? Because one, the temperature is high, and then it's always hot here, as we believe, and then we are not also used to it. So this time that we are practicing, so if somebody put the nose mask, for a moment they just pull it like this and then remove it for, and we believe that when we are going to meet, going traveling or moving elsewhere, or meeting like a cloud, and people try to, put it back. So it's as gradually improving because the education is going high. So I think for that one too is gradually improving. People are wearing masks, especially when people are moving out, knowing that we're going to meet with and maybe other people, like traveling, even though transport has become more issues. And then the government too has put in a very nice measure, like, the way that we're sitting on our cars and the vans, they've also reduced the number of persons so that because of the social distance. So if you find people
I see.
traveling, people also try to wear the mask. And the security personnel are also on job, on top of their job, because sometimes you find some of the military personnel, the security personnel, the police, trying also asking people about where you going, you know, and then do you have a sanitizer with you? Where is your nose mask? And so on, which is, I think it's going well. It's
Hmm.
going well. You know, only that it takes some time.
That's good.
Like I mentioned that because of our, cultural practices, it takes some time. Yeah.
That makes a lot of sense.
So, Brother
Good
Bowman,
morning.
do you Mr. Boamah, do you know anybody that has been
Hello.
infected with COVID-19 or impacted health-wise? Do you know anyone in Ghana that has been impacted health-wise or infected with?
The answer is no.
You said the
The
answer is
answer
no?
is we only know get the information from the Ghana health services, but people are not being they don't try telling that this person David Obama is being infected. Like we sometimes see that on some part of the world, So Ghana they only report about this, but I don't know anybody, you know.
Okay.
Yeah, neither can you suspect. Yeah,
Okay, but
so
that's a
it's
good
only the
sign.
health
That's a
workers, So we based on the updates.
I think he might have.
So guys, it looks like we lost him
Dr.
momentarily.
Cadet?
It
Yeah.
looks like
And
we
he's
did.
outside, so
He's outside, and as he communicated to us right when we were starting, they're about to
yeah.
have a storm. So the wind is picking up, and it looks like we lost his connection. If I may, so what we began to talk about just prior to the live stream, and I know he wanted to chime in with is to communicate, which he did, as far as the lack of certain resources, like for instance TVs. So there's an inability for children in some parts, particularly in Toso and other parts that he mentioned, to be able to continue with school. He also mentioned that they're having a challenge because so many people are dependent on, agriculture or the tourism and trade. And now, of course, they don't have that ability because there's a lack of
Right.
tourists or the lack of ability to go to the city. So he definitely wanted to communicate the message that, they have a need there that's beginning to get dire in certain places because people need to eat. They need to, carry on some of the normal.
Connect him back in.
Great.
Right. And with the lack of, like you mentioned, television, we're talking about communication as well, because they need
Hello.
to be apprised of what's going on around them as well. So hopefully they can utilize radios. Oh, there you are, Mr. Bowen. We lost you for a minute.
Can you hear us, David?
Dai, Dai. Hello?
Can you hear us?
I'm not sure.
I think we can see him. David?
I think once he establishes his connection, then Miss
We'll
Walker
come
will
back.
bring him back. Yeah.
If I may, Angel, there's a comment that a viewer did put on. I'm looking at the viewer chat, and I wanted to address it. This comment is talking about, if I understand it, that there's information coming out that there's no bats involved, and so therefore we're not being told the truth. I did want to address that because it's important to make sure the message is responsible. And, as a scientist, as a virologist specifically, and I have worked with coronaviruses, I've been doing my research and looking into this, and I have to say that there are, we don't know 100% where this virus came from yet. We are still searching, but there's a lot of evidence indicating that bats were definitely involved, as well as another animal, most likely at least one additional animal. So, based on the genetic sequence of the original virus, as well as, you can analyze the small mutations that have happened, and, as the virus infects others, we still see that it is fairly closely related to other coronavirus that has come out of bats. And then we're looking to see what additional animals it may have intermingled with. But I want to make sure that that message gets out there just in case, because there's a lot of misinformation, and it's unfortunate. And it's because at this point we don't have all the answers yet. But just wanted to stress that. Thank you.
Thank you. Mr. Boamah, can you hear us now?
Hello?
Can you hear us?
Okay, I'm back. Okay, so
Yes.
All right. That's what I like to do.
good. So if in case somebody want to follow the update I'm giving, we have a website that is GhanaHealthService.org. GhanaHealthService.org. So whoever doesn't want to do, or want to follow up that can also go into this website and then get all these updates from. Okay, Ghana, yes. So everything that I'm reading is not something that I'm reading from my own. When it comes to COVID-19, the only thing that I'm see that Ghana, when it comes to the statistics, okay, but when it comes to the impact, it's real. But when it comes to the impact in Intonso, it is not the Ghana Health Service which has to determine the living of the people of Intonso, for us, but it's for me as an indigene and the person living in the village, being with the people who can tell the rare situation on grounds. Okay, so now I want to talk to about mention about the affected regions in Ghana, which is information that has been provided by the Ghana Health Service. Greater Accra region, Ashanti region, we have the northern region, we have the central region, we have the upper east region, we have the upper west region, we have the eastern region, we have the northeast region, which is one of the newly created regions, and we also have the Volta region and then western region. Initially, the focus, the attention was on based on the Greater Accra region and then the Ashanti region. So the government, the lockdown, partial lockdown, started from the Greater Accra region and then the Ashanti region. Okay, and then initially Ghana has a 2-week lockdown, partial lockdown, which was being announced by the president, His Excellency himself. And recently, he also added an additional week, and now it has been extended to some regions. Okay, so that is so far the situation in Ghana. Okay, yeah. So we are still like as I mentioned that like talking about using the PPE, like the how do you call it, the mask, the sanitizer. I can tell you within the first week,
Yes.
sanitizer got short, and people also had to increase price. I bought them some myself to be given to some people. And you go to the shop, you go to the chemist, prices had to go up. It's now people have also seen, and then the locals are also making more hand sanitizers. Now that we get some of the sanitizers in the market, and the question is even what guarantees that this is of good qualities, because definitely there might be some bad knobs. People might also produce something to earn money. You see, so and now we say that, and then people
That's a
the
good.
locals, So now it's very interesting that they've been identifying locals, even in my community. I've asked my partner making nose masks. Tailor seamstresses, people are fashion designers are also making it, and some people are also giving them for free. And we also have some individuals who have the money buying food stuff, buying other stuff like sanitizers, soap, And we also have the Veronica bucket, which has also become marketable, so that there was always water for people to turn on the tap, wash their hands frequently, even moving along the roadside. In
Oh, that
Ghana,
is awesome.
we've also advised that it has to be done at least 20 minutes within 20 minutes, because we cannot wake up in the morning without dealing with money. And everybody who have been in Ghana knows the way the manner we entreat our money. If somebody gives me $1, I'm going to keep this dollar safe to make sure that it is well kept, because I believe if it is when it get dead and I'm going to change it for cities, nobody is going to take it, or else I'll get it at a lower rate. But look at how we do to our own currency, our cities. It get dead. We just fold it like that. So we know the transaction, the mode of transmission. So once you deal with money, we try to wash our hands frequently. And then we
Very
use the
important.
sanitizer. You see? So it's not about somebody sneezing or coughing on you. It's also could be like the transactions on money. You know, taking money. I'm seeing that sometimes when you go to the local communities.
I'd like to ask you a question about the Mr. Bowman. I'd like to ask you a couple of questions about the students. How many students
Okay.
are at the school current? Well, I know that the school is closed, but how many students are at the school?
Um, in the Entonso MA school, yeah.
Hmm?
I think I have. If I knew that this question was going to drop, I should have checked, because I was getting information for some people, and then I think it was they had the primary from the nursery to the class 6. I don't know. Maybe you call the grades. I don't know how you refer to the grades. From the nursery to the class 6, they were like 300 pupils plus. And then from the junior high school, as we call the JHS, they were 180 for the intensive FA school. And that is not even the only school in my village. We also have the Roman Catholic school, which has
Okay.
a large population. We also have the SD. They have many schools as well as public and then private schools. And then we also have the Islamic schools there. You know, we have the for
So,
Islamic school, we have the Handania, and they also have the Nuru Salam school, and they also have a large population. Not to mention about the how do you call it, the private ones. But you see, we've community action now focused on the MA school, because that is the mainly public school for the state, for the government. When I talk of Roman
Mm-hmm.
Catholic, the mission could support the SDA, the Seventh Day Adventist school. The mission could be of help. But when you talk the MA and the DA schools, those are the schools in need. They only relied on the state's coffers, on the government coffers. So if the government doesn't give, or if a philanthropist doesn't come to their aid, they are dying. Okay. So I think so far these are some of the challenges. You know,
I see.
I can tell you, for Threat Foundation, we also have our own challenge. We also have our own challenges, because we run a co-curriculum program, which is after-school program that we also try to meet with the kids. And then by so doing this, what we do is that we do organize classes for them, academic, cultural. So when it comes to the academic, when they have like the big brother, the big sister helping the young brother, the young sister, okay, after school. So if I have like an assignment, then what the younger one cannot do, then the big one can assist. So we coordinate, and sometimes we do a general classes for them. We do reading, stuff for them. And when it comes to the culture, we teach them about the norms, um, we teach them about the culture, how we practice our culture. and then we also try to connect it to the, our the local ones, and then they also looking at the foreign culture, because we are also dealing with foreigners come to our community. So how do we have to do with the two? Okay, and we do so we do the cultural drumming and dancing. So maybe if you come to me,
Mm-hmm.
you donate to me, I have nothing to give out. I do cultural dance, drumming, and that alone pays you back because it does
Mm-hmm.
attracts you. Okay, and then alongside we also teaching them the Adinkra cultural work. Like see me wearing
Mm-hmm.
this beautiful Adinkra shirt. Okay, if I turn on my back, you see that I have multiple symbols at the back also. I don't know, maybe it's upside down. Good. So, we came to inherit our ancestors. Adinkra has gone back to generation. Generation has come, generation has passed, yet Adinkra is still in existence. So, by so doing this, we also teaching the younger ones how to make it. Because people that we came to meet, they all gone. Now, we are also in our 40s, doing it. It will be a time, Boamah David, that you see me today, it's not going to be same the next time. Okay, what guarantees if I'm still going to survive? So we try and teaching the younger ones about it, so that the way we were taught is the way we are also teaching them. We also make it in the form that it become more formal, so that when you don't just rely on that, we also take education serious. If I had not gotten at least educational background, how would I report it to you? How would I talking to you? How
Right.
would I express myself when people come to me? Okay, so based on that, we don't want them to go like that. So we let me also take this opportunity to say that what Trust Foundation is trying or dreamed to do is to build a multi-purpose center, a center which will have a library, a center which will have a theater hall, a center which
Mm-hmm.
will have offices, and a center which will have a place for making a dinkra. And then also we trying to empower the youth, as we try to talk about it, teach them about self-sustainability. So by so doing this, um, and also talking about health, I have worked on the field of HIV for some time, and we try to have the especially the youth, the female youth, okay, to debit, to stay, or delay their sexual debit, so that a man will not just engage them with their money, okay, to have, so to retard, teenage pregnancy and all sort of things. As you have a formal education, you're also trying to empower them, by doing apprenticeship program. So some of them we
It
teaching
sounds
them
like
how
you
to
have.
make batik, because personally I know how to make batik, and then also, hello,
Hello. I was going to say that
hello, can you hear me?
it seems like you have. Yes. Can you hear me? Can you hear
Yes,
me?
please, Yvonne. Yes,
This is
please. Yes,
Valerie.
I can hear you.
Great. Sounds like you have so many wonderful programs to help the community as well as youth and ensure that we can bring people out of poverty and into success. How can people help? How can we help? How can not just community action now? How can everybody watching help promote this and help in the COVID-19 challenge Ghana and your community is facing?
That's a good question. So, we sometimes, for now, let me say that Threat Foundation has also halted. We stopped, most of our activities because it comes to halt, because this is how we get support. Like, alongside, like a community action now did, and then the money went into, the school project, restoring the school building, okay, fixing the doors, the windows, and making tests, for them. We also try. It's not every also doing our best by, when we also David make a dinkra and I also make workshops. So whatever I make, whatever we sell, certain percentage amount goes into support the children. Okay, most children in the community, and that is why we have the initiative called Fred Happy Child Club. This is a club we set up to bring children from all angles together so that we so to know, to learn how to socialize, and then we support them educational materials, and health also being our priority. So at the end of every year, we try to register them or renew their health insurance for them, so that when they get sick, they can go to the hospital with the health insurance. Okay, and then also sometimes we provide them, with educational materials. So sometimes you also have friends who comes to the shop, and people buy. We use some of the money to support these children, and then also people feel hard. They have the goodwill to donate. Okay, and people donate like, oh David, I have like, let me talk in my currency. I have like a 50 CD, and the 50 CD is like a $10. Let me put it that way, or $9 point some 9 and some cent, right? Let me say $10. So if somebody gives $10, we get a 50 CDs, and I tell you, I don't keep the money myself. I say, I bought the land, and I said, this land has been dedicated to build the center. And now we have all this that you can see. I want the world to see we have these blocks. All these are concrete blocks ready for building. We have 6,000 of them. Okay. We
Wow.
have the chippings, because we also got wonderful people. If I want to mention names, like we have the Colorado people, we have individuals like friends, and on Facebook they see us and they come and they make donation, and this is what we're trying to do to build this center over here so that we can have a place to bring people. But now all the attention has been drawn into COVID-19. Talking about COVID-19, the priority is feeding the people and thinking about their health. So recently,
Yes.
recently on Sunday, what I did, I got a friend who sent some money and had to add the difference, and we got bags of rice, and we got like a sardine, mixed with tomato, sauce or whatever it is. And then, so what we did is we tried giving it out to some children. So at least every child got a 1 kilo, rice and the sardine taken home. And
Mm.
the pictures, I actually don't like taking pictures of doing this, but this time I tried. And whoever want to see this can go to our page on Facebook, Thread Foundation. Just click on Thread Foundation. Pictures are there. Or if you go to my personal wall, the pictures are there. People have reacted on that. You know. So now,
Mr. Bo
okay,
Mr. Bowman?
yes, please.
Yeah. So we're gonna be getting a bit close. We're getting a bit closer to our 1 o'clock mark.
Okay,
So I would like for you to utilize this time, whereas you would tell everyone about the school and how they can contact you or the school if anybody out there is listening that would like to support the school at this time because of the challenges that you're experiencing. So please let them know what your website is, or if you have a contact number that's maybe WhatsApp or whatever you feel comfortable giving out, or email, so that individuals who are interested in support the cause and of course the school with any challenges that you're facing can try to assist.
oh, okay. So now if somebody, whoever want to support, um, Ghana, it could go anywhere. It can go beyond Intonso, because when people of Intonso are being fed, we have to extend it. So so people can reach out to me check me on Facebook, Facebook. The name is Boamah David. If you hit on Boamah David, you're going to get about thousands of Boamah David. So just go like this: B David. I take the B from the Boamah. Okay, David 77 at yahoo.com. I repeat, B David 77 at yahoo.com. You can get me on Facebook, and then you can send whatever information, anything that you want to know, and we can also talk about means of making whatever you want to send, and then we talk about means of doing so. Or you can also send email to Fred Inc. Fred THREADINC at yahoo.com. Fred Inc. at yahoo.com. It will also come to me. And then you can also go on WhatsApp. So it's plus 233 5207. Sorry, plus 233 207 386917. All this means you can reach out to me, and then we talk about how you want to support, and then we see the way forward. Then we move on. So I'm very happy, and I can see that somebody just sent a friend request. It just popped in that, by giving that information.
Oh,
Somebody
that,
just sent. So this is no,
that was
yeah,
me.
yeah. Oh,
That
you
was
did
me.
it? Good. So okay. So so we are trying, working hard here, and
That was me.
we are also praying that and hoping that everybody stays safe. My fellow people in Ghana and the whoever is watching me all over the world, let's go by the simple rules and regulations, taking the precautions of this COVID-19. So the next time we talk, maybe I will show the precaution sign. Okay, we call it pimpamca. Okay, let's take the precautions so that we don't also want have to fall victim, because nobody knows who is going to be what in the near future. So let's love our lives, let's love ourselves, and then let's keep ourselves safe and then healthy. So I want to thank everybody
Yes.
for giving me such a wonderful platform, and I would say medase.
Thank you,
Medase
David.
means thank you.
What
Midase.
I say?
Thank you
One
so
And
much.
that's
quick,
good.
quick
This
thing.
has been
Okay,
great.
This has been
okay,
wonderful. David, before you hang up, I want to
yes,
say thank you for all of the work that you are doing um, to our amazing school there. I know 3 years ago it was 105 Ghanaian children that were served at that school. So we're so happy to hear that the numbers are going up. And we're very prayerful that life is going to get back to the way it used to be, or even better. We're hoping for better than it was before. And as soon as the dust clears, we are going to be scheduling and coordinating our missions to the school in Ghana from the U.S. Virgin Islands and from East Metro Atlanta. So we're excited about that. As soon as the dust clears and we've got okay to travel, then we will be there. Thank you.
Thank you.
thank you so much. We're
Thank
looking
you.
forward to seeing you. We cannot wait to see you, and we love you all. Much
Thank
love from Ghana, much love from Africa.
Love you
We love
too.
you.
thank
We
Stay
love you.
safe.
We love you.
you too.
God bless you all. Stay safe. Stay well.
We love you
Okay.
too. You too.
Okay.
All right.
Bye bye.
Thank you. You too. Bye bye.